All right, so my name is Bob Foster, and I do a lot of peripheral cases and want to show you how to do the peripheral cases based on the access to be able to have multiple sites of access to do your PAD cases. So I'm able to do pretty much all PAD cases from the groin, from a pedal approach. And I want to show you my setup for that. First thing, most important thing is to make sure the Rampart is set up correctly. And again, you want the lower extremity panel to be across the patient. You want the soft portions of the accessory to be over the patient to prevent scatter. Keep in mind that you have access to your controls, and so getting your access and moving the patient in and out should be very simple for you, because the lower extremity panel soft shielding can drag the sheath out. I always secure my sheaths, and so that is an important portion. So we have the below the table protection and above the table extensions. That's very important. You have your CMA, and then you have your rack accessory. So that keeps keeps the scatter from reducing your scatter radiation. So the first thing I want to show you is if we're doing a left lower extremity intervention from the right groin. So typically what I do, and the only difference that I do from what I used to do, I use a slightly longer sheath. So this 65 centimeter destination sheath, I put these orange markers on it just to so you can see it a little bit better. And basically I get access, numb up the groin, get my access, and then I just slide the patient in. Then I'm able to see, again, I pull this out and hold my hand in place. I'm able to go up and over to the other leg. The reason I use a slightly longer sheath is because when you're going up and over, you're going to want some of your catheter still extending out and below your soft shielding. So if on this patient, if we're going up and over, typically I'll have about this much of my sheath sticking out. And so that still gives me access to go up and over, and then image that leg. Again, I can just advance it in, open the shield if I need to, and I can move my camera down and go all the way down the leg. Okay. Even so, if you wanted to get all the way down to the below the knee on the left leg, again, you can just advance the patient in and see below the knee. And advance the patient back if you need the groin access. Once again, I do secure the catheter. That way, the rack accessory soft shielding won't pull it out. So that is right to left leg. Okay. And I put this in the patient basically in the standard position. My table set up exactly the same way. Now to do pedal cases are very easily done with Rampart. And basically I'll place my controls below the feet, and that's important because if you have them right here, you're going to be advancing this as you want to see from really the shins down to the tibial area. So you want your controls to be to your right. So I'll, under ultrasound guidance, get my access. So under ultrasound guidance, I'll get my access, and then when I advance, I can just advance my catheters in. Again, when you do this, as you move down, you'll want to either raise the table so that it lowers your gap here. Okay. Get your soft shielding, and then you have your access right there at the ankle, and you can work anywhere in the leg. I do a lot of pedal cases. Fixing SFAs works great for that, because then you're working like right there is where the SFA is. Your ankle's right here, and so your tibial vessels are really easy to access with the lower extremity panel going straight across at the shin level. Those are the accesses. If you're going pedal, we put the patient in the normal position. If you're going from the right leg over to the left leg. Patient is in the normal position. So that's how those are done. And the only two things that, again, I would remind you is, number one, use a slightly longer sheath when you're going up and over, usually 65 centimeter, to be able to go up and over. And then when you're doing pedal cases, make sure that your controls, if you run your own table, to be at the right or below the foot level, so you can advance this easy and don't have to step back and feel like you're reaching. Okay. So now I want to show you a couple more access sites. So if you're going anti-grade down, straight down the leg, again, you want your lower extremity panel to be across the patient, and the rack accessory to drapes to be to lay across the patient. You have an anti-grade stick. You can do an ultrasound. Again, don't be afraid to move the patient back, get your access. Once you get your access, just slide the patient in where you can see and go straight down the leg and do your SFA, or again, just move your camera down, and you can move the camera down all the way down the leg and do pedal approaches. So if you want to get down all the way down the leg, you can do a pedal approach. I mean, do a pedal access if you want to just move the camera down, or again, you can pan if you want to. Okay, so that's anti-grade stick, right and left. I use standard sheaths and go straight down. I would secure that sheath. Again, you don't want the accessory. You don't want the rack accessory to drag across that sheath and pull it out. You still have access to it, so you can see it and watch it fairly easily. Now, if you're going to go and do a left leg to right leg, I do those in this position as well. The only caveat to that is that I will put on my lead apron and be on the other side and go get my access. And the reason that I do that, and you can do it, you can just move the Rampart out. It's very easy to move out. Okay, you have your lead apron on. You basically just go up and over. Typically, once again, we use a longer sheath, 65 centimeter destination sheath, to take this up and over. Once it gets up and over, okay, and I have that in position, then I'll actually break scrub, take my lead off, and then just put my scrub back, put my sterile gown back on, move the Rampart back in, and again the Rampart. Let me just do that again since that wasn't so easy. So then once you take your lead off, get scrub back in, you basically just slide the Rampart back in right over the leg. Okay, and you're ready to go for the long case. Remember, most of your radiation you're going to get while you're doing the case and not just putting in the sheath. So if it's just wearing the lead apron for just a few minutes just to get the up and over, then that's all you need to do. So again, we already have our sheath in there, okay? And so the sheath's going up and over. Then I reach up underneath, grab my sheath, and now I have the access point to my sheath here. Now what this is going to do is it's going to form just a slight S on the patient. It's going to look like that, okay? So basically you have access to your sheath. All your catheter is going to go up, over the bifurcation, and down the other leg. So, and you can fix SFA, pedal, whatever you need to from that position. So those are the positions that I do. Again, you can move the patient back to remove it, and you can just remove it back. And so that's all the access points. We can go up and over, right to left, anti-grade sticks in this position, and then with the patient in the regular position with the feet toward you, then you can go up and over, right to left, and you can and you do your pedal approaches. So appreciate it.